Well, you talk about the metal in the mouth. I wanted to just ask you, what are options for people who do have metal and crown, titanium? What are some options that you can do in this clinic to clean them of the toxicity?
You can remove the metal. Even the implants can be removed.
Okay. And what do you use instead of metal then?
You can use, for the implants here, we use ceramic implants.
Is that different from other?
Well, it's, I think Dr. Benoit, whom I work with, is the only one in Quebec to use these implants, actually, at the moment. Something which has been developed over years. It's been more than 15 years that they started working on them in Switzerland. So that now they're really reliable. It's something that's really working. But before, there was only titanium for implants. So people got used to using titanium. And once you're used to a technique, once you're used to a material and you're comfortable with it, and especially if you're not worried about what's this titanium implant going to do with the mercury filling, what's it going to do with the rest, then you keep doing it, and you don't, you don't question what you're used to and what works for you. And here we're going to use non-metallic implants. Speaking of the silver mercury fillings, you know, mercury is a toxic, no matter what you say about it, it's a toxic.
My oldest memory is in elementary school when we dropped the thermometer and the mercury liquid is out on the floor. Everybody has to back out.
Everybody leave the room, open the windows, and you know, and at school, because we graduate as every dentist, you know, it's the regular dentist school. I graduated from a university in France, and I was, you know, I practiced the way I was taught. That mercury, once the silver mercury filling has reacted, once it's hardened, it's a very stable compound.
Well, actually, I've heard that from other dentists that tell me, no, once it's sealed, it doesn't harm the body.
That's what we learn at school.
Yeah, but the thing is, from my experience, I wear a mouth guard, and for many years, over 10 years, I've had a metal filling up here, the top left, and I remember seeing a stain on my mouth guard, never understanding why.
Yeah, yeah.
And so it was leaking all these years.
It was leaking, there's metallic reaction, and also when one of the reasons why I became a holistic dentist is because at first I believed everything I was taught about. So they told me silver mercury fillings are safe, they're stable, so it's okay. But then somebody close to me, a member of my family, got sick, and we investigated. We didn't know what was going on. There was neurological reactions and loss of sensitivity in the hands, in the legs. It was really, really bad. And we did a lot of medical examinations and tried to find out what was going on, and the answers were not satisfying. They didn't know what was going on. They could only tell us, well, we see things are affecting you, but we don't know what it is. And then we thought, well, we are both dentists. We work with mercury, and what we read about mercury seems to, you know, be related to that. If you read about mercury intoxication, it can have the same symptoms.
Okay.
So we started investigating.
So neural damage.
Neural damage, yeah, definitely, and getting worse and worse in a fast pace. And so we said, but we learned that it's stable. How could that be? We work in a scientific way, so we want to confirm it's not beliefs, it's medical procedures, it's scientific procedures to find out what's going on, how does it work, etc. We need explanations at some point. And for that, we did some testings. Back then we were living in France, and there are labs in Germany to which you can send your saliva samples, and then they're going to tell you what's in there, and especially mercury. And so we did testing for ourselves, and there was a lot, especially for myself. I had a lot of silver mercury fillings in my mouth. There was a lot of mercury in the saliva, and we started thinking, well, that doesn't fit what we learned and what we were taught. So, and then we started reading more. And obviously this was, well, wrong information. I wouldn't say lies, but it's not that simple. And definitely mercury is leaking from the fillings at all time. With the temperature in your mouth, there's mercury vapors. With chewing, grinding, especially if you chew gums all day long, you're gonna have more rubbing of the teeth against each other, so more mercury leaking. And the mercury goes through the gums into the bloodstream. You inhale it because your mouth is related to your nose. So you inhale it, and the brain's not very far from it. So you keep piling up amounts, very small amounts of mercury, but all the time. And this can affect your body and your health in general, definitely. And some of us are more sensitive, some are not. So what I often say to my patients is, some people are going to have supermercury fillings all over the mouth. They're going to drink a lot of alcohol, they're going to smoke, and they're going to live a very long time. But that's very rare. Most of us are more sensitive, so whatever you do to harm your body is going to affect your health. And so what we want to do is avoid whatever, as much as possible, avoid aggressing your body, stressing it. So we don't want to be part of this. And as we learned that mercury was a problem, I made a change in my practice. So I started thinking more about what I'm doing and how it affects people. And in my case, I shifted my way of practicing, but it's all related. What I preach is what I practice. So I had all my supermercury fillings removed in a safe way. Here by Dr. Benoit, whom I work with. I changed my diet. I really did a lot of changes in my life, because when I tell my patients what I suggest, that because I experience it and because I deeply trust it, and I know what it does, and there's what I feel, but there's also the scientific basis for that. There's a lot of studies, there's a lot of documents that can confirm this. And supermercury fillings we were talking about, they can definitely harm your health. In Europe, it's been banned in many countries for years. When I was at school 25 years ago, they taught us in France that you're not supposed to do supermercury fillings for young children. You're not supposed to do it for pregnant women or for breastfeeding women. So they knew, if you say don't do it for these people, it's because they're weaker. Okay, but how do you know that other people are not weak? If you want to be careful for a part of the population, be careful with everybody. Let them know that there's a risk. As a dentist, when you receive the containers, they're sealed. There's in containers that are sealed, and there's these skull and bones little logo
like
there,
hazard
sign, and it tells you state of California acknowledges that it can cause birth defects and can affect the environment and stuff. So okay, there's a problem, but well, we can use it because we've been taught you can use it. Then you place it in the mouth, and it's supposed to be healthy. But then when you remove them on our devices, the dental devices, there's something to collect the mercury from the water system, and then what is collected is treated as toxic waste. So it's again in the sealed containers, and it's taken care of very carefully because it is toxic. So it's toxic before, it's toxic after, but in your mouth it should be fine. So it's really something that wouldn't make sense to me. You have to be extra careful. So that's the reason why here at Global Dental Art, when we remove the mercury fillings, we pay really attention to the way of doing it. We protect the patients and we protect ourselves, because we know that it's when you remove them that you're going to vaporize a huge amount of mercury, that you're going to do harm to the patients if you're not careful in the way you do it.
So there's a strict procedure that you follow to do. You wouldn't recommend anybody to just walk into a normal standard dental clinic to remove their
No. Or at least ask the dentist what they're going to do to protect you while they remove the mercury.
Okay, so
how are they going to do it?
Right. So what do you do to protect the patient and yourself when you're removing the
we give the patient activated charcoal just before the procedure, because activated charcoal absorbs the toxics. So if ever there is a leak in the mercury vapors go through all the things we put around the teeth, the activated charcoal is going to capture the mercury and drain it from your body. We place a dam, non-latex dam around the teeth. It's kind of like an umbrella around the teeth. So we work over the umbrella and with a suction over it, and so it's not in contact with the rest of your mouth. The water we use, and we use a lot of water to cool it down, to cool the mercury fillings down, to reduce the vapor emission. Strong suction, there's another suction with charcoal filter in it. We place a mask over the patient's nose to breathe air from outside the clinic and not the air in the room while we remove the filling. Strong suction over and under. We give vitamin C when we're done. And so we are very, very careful about it. And because not only is the patient exposed to that, but the dentist, the assistant, the professionals in the office are exposed to mercury. And we do that on a regular basis. If you do that, dentists should think about it as a protection for themselves as well.
For sure, yes.
Because it's
because they're exposed to it even
exactly,
more, so
more,
they're looking
definitely more.
and dealing with it up close.
Yes. Yeah. So what I would tell a patient who's not going to see a holistic dentist to have mercury fillings removed is, ask the dentist, do you pay attention to the way you're going to remove my fillings? What you're going to do about it? And the minimum is to use a dam, but it's really the minimum thing to do. Definitely, I would encourage people to read about it and make up their own minds.
Right. Well, I think that's a really important point. Like, if you're an informed consumer, then you have more options, right?
Exactly.
You understand a little bit more of the effects, and you can make better decisions for yourself.
Yes.
What about root canals? That's another area where I hear of all the bacteria that can result in the dead tissue, and it can go through your body.
Exactly. Because as you said, the tooth is a living organ. So when it's alive, there's a blood flow, there's a defense system. The tooth can defend itself against bacteria. And when it's dead, you remove what makes it alive. You remove the pulp, which is the blood vessels, the nerves and tissues inside the tooth. And so the tooth is still there, but it's like an empty shell. And instead of having the pressure coming from the bloodstream, which brings the minerals, brings everything, and keeps the bacteria away, the tooth becomes like a sponge, because the anatomic structure of a tooth is there's thousands of little tubes from the pulp to the outside, through which you get the sensitivity when it's cold or warm on the tooth by dilating or contracting the liquids, the fluids in these little tubes. And when the tooth is dead, there's no cells in there, but the tubes are empty, like tunnels, in which bacteria can gather, and there's no blood flow in there. So your tooth cannot defend itself anymore. And so with time it can gather bacteria. No matter how good the endodontist is, no matter how well the root canal is done, the root canal procedure is performed, there's no way you can disinfect these little tubes. And it can, from our point of view, it can, and we're not alone to think that, but it can affect your health with time, because bacteria can gather in these little tubes and thrive there, and and your body gets kind of used to it. Your immune system has to deal with it, but you don't see any. It's not like an acute issue. It becomes chronic, and then the bacteria that are there, sometimes they pass through your blood flow, and it's okay. Your immune system deals with it. But then at some point, if you get weaker, if your immune system doesn't work so well, these bacteria can cause a problem somewhere else in your body. It can be liver, kidney, whatever you're more likely to have from a genetic point of view. Your body can start a disease, or a health issue can be worse because of that. Right. So that is something to consider, and we want people to know about it. And sometimes people have health issues. They go through a lot of medical examinations, and the doctors don't know what's causing the problem, so they deal with the symptoms. And we just want people to know that these dead teeth can be part of the problem. I'm not saying they cause every health issue that you can have, but you have to keep in mind that they can be part of the problem, and they can really make things worse in some cases. So you want to know about it, and that's, sometimes if you've gone through a lot of exams, and and the doctors say, well, I don't know what's going on, and you know that there's these dead teeth in your mouth. At some point it may be interesting to say, well, how about having them pulled out, having them removed, and see if that helps, because at some point if you weigh the pros and cons, you think, well, it's not an easy decision, it's not something you're going to do like easily, to go, well, I'm going to have my teeth pulled. But you want to consider the advantages of that and the results that you may achieve. And there are ways of replacing the dead teeth. You can have a non-metallic implant instead.
So that's what you would say the alternative is?
That's the alternative. The main alternative is to have the tooth extracted and replaced with an implant. And if possible, definitely recommend a non-metallic one. Because titanium, there are titanium oxides. There's oxidation in your body, and there's titanium particles traveling through your body if you have titanium implants, which may not be a problem for some patients. Again, it's not, like everybody's going to have issues with that. But if you have two options, it's always about choosing the best according to what we know at the moment. And we know that silver mercury fillings are not the healthiest things. So we do most of the times composite fillings. Some of them have BPA in them. They release more BPA than the others, which is a toxic for your body. It affects your hormones. It acts as a hormone actually, and that's what it was removed from the baby bottles
and
then from the and then after that it was removed from everything we use for our food and drinks. So their BPA can be released from composites. So the ones we choose release no BPA or as little as possible, and we keep changing. Whenever we learn this has come out and it's better than what you use right now, well, we're going to move to whatever is better and better. We keep changing things and we keep learning. We don't have the truth. We don't know everything. We keep learning. But for sure what we want to do is use what's less toxic for our patients, use what has less side effects for our patients, and empower our patients by helping them understand what's going on. We give you the information, and then your choice we respect, because you know different points of view. And if you want to go with a root canal, I'm not super happy with it, but I'm going to respect that because that's your choice. And you may be more comfortable having a root canal procedure done right now than having your tooth extracted. Because if you have your tooth extracted but you're not psychologically ready for that, that's a trauma. And the trauma can also affect your health.
So there are times when it's better to wait.
When you're not in an emergency situation, I always tell people, think about it, take time.
What about for amalgams? Are there any time when you think it's better to wait than to remove?
If the patient has major health issues, if they're very fragile at the moment, some of our patients have really like a neurodegenerative issues. They're really weak. They're anything can affect them and makes them sicker, and it takes more time for them to heal from anything. So when we have such patients, sometimes we're going to remove one mercury filling at a time instead of doing the whole side, which sometimes we remove 2, 3, 4, 5 teeth at the same time for healthy patients. But some patients we just really do it very, very slowly, or sometimes we wait for the naturopath to give us the go, to tell us, well, the patient is too weak at the moment, their immune system is not strong enough, they don't detoxicate well, so it's better not to do anything right now. Okay,
because once you finish removing it, they still need to detoxify the body.
Exactly.
Right? So that's something that they would have to see the naturopath in order to get a protocol.
Definitely, yeah, to know what is best for them. There's not one recipe that's going to work for everybody, and you have to consider what's the strong parts in the patient, and what's weaker, and you have to work on that, and you have to make sure what you do to detoxicate is not going to affect the liver. For example, if your liver doesn't work well, if you get the mercury, all the heavy metals, aluminum, lead, or everything that's built up in your body that you've stored with time, if you just drain that and get them from your brain or your fat, and you just get it back into your system, well, it can affect your liver, and it can have toxicity in your liver. So you have to make sure it works well, and whatever you're going to drain from your cells is going to be drained out of your body and not drained somewhere else inside, and stay inside your body.